As we all know, it is the New York State of Health open enrollment period for 2022. It should be noted that the open enrollment is that time of the year for eligible residents to enroll in the advanced premium tax credits with or without cost sharing reduction and the full pay qualified health plan for the year 2022. Open enrollment does not relate to Medicaid, Essential Plan, and Child Care Plus. So that means for those three other programs, enrollment can be completed at any time during the year. Now, the Legal Assistance of Western New York offers free assistance with the New York State of Health application and enrollment under the Navigators program. And this presentation is to give us basic information about the New York State of Health programs and to also enlighten us about our benefits and rights under these programs. New York State of Health application can be completed and submitted online via the New York State of Health website. You can also call to the marketplace directly or reach out to an assister like myself, either in person or over the phone for assistance. To be eligible for coverage through the marketplace, you must be a resident of New York State, have qualifying immigration status, and must not be older than 65 years. The New York State of Health basically have two applications. We have the financial and non-financial application. For this presentation, we'll be focusing on the programs under the financial application. And these are Medicaid, Child Care Plus, Essential Plan, Advanced Premium Tax Credits, and the Cost Sharing Reduction Program. At our last presentation, we talked about Medicaid. If you missed that presentation, it is available on the Legal Assistance of Western New York YouTube channel. You can go over to view it, drop your comments and questions, and I'll assure you of a prompt response. For today's presentation, we'll be talking about the Essential Plan. So the Essential Plan is one of the subsidized programs of the New York State of Health. It covers essential health benefits, including your inpatient and outpatient care, prescription drugs, physician services, among others. There is no deductible under the Essential Plan program, and there is very low out-of-pocket costs for this program. There are 4 levels of the Essential Plan. We have the Essential Plan 1, 2, 3, and 4. The level you qualify for depends on the information entered on the application. Essential Plan 3 and 4 are available to immigrants that would have qualified for Medicaid if not for their immigration status. While the Essential Plan 1 are available to both citizens and eligible immigrants. To be eligible for the Essential Plan, you must be between the age of 19 and 64. The system would also look into your immigration status, household size, and income. To give a clearer picture of how income and household size is used for eligibility determination, we'll look at this chart, which provides us with estimated income with household size for eligibility determination by the marketplace. Now, these are just estimates. You would see that the Essential Plan 3 and 4 are put under the same bracket, so that if you are within 100% up to 138% of the federal poverty level, you would qualify for the Essential Plan 3. Below 100% of the federal poverty level would qualify you for Essential Plan 4. And again, remember, this program is available to immigrants that would have qualified for Medicaid if not for their immigration status. So you will see that the income requirement is similar to what we have under Medicaid eligibility. From 138% up to 150% of the federal poverty level will qualify you for the Essential Plan 2, and from 150 to 200% of the federal poverty level will be eligible for the Essential Plan 1. Now, when the New York State of Health is talking about your income, they are looking for your AGI, that is your adjusted gross income. By adjusted gross income, we mean income before taxes. So let's be mindful when we complete the application that we need to provide our income before taxes are taken out. The bottom chart provides us with the monthly amount for determination, just like the upper one gave us the annual. And like I said earlier, there are co-pays under the Essential Plan. Co-pay is part of your out-of-pocket cost for services and prescriptions. And when we look at this chart, you will see that income limit of $19,321 up to about $25,000, which qualifies you for the Essential Plan 1, would have you pay the following copay for services. Your primary care physician visit will be $15. Specialist visits would be $25. Inpatient hospital stay upon discharge, that is per admission. No matter how long you stay in the hospital, when you are admitted and discharged, you would only pay $150, and that is for the Essential Plan 1. Behavioral health outpatient visit is $15. Inpatient visit for behavioral health services is $150 per admission. Emergency room will be $75. Urgent care is $25. Physical, speech, and occupational therapy is $15. When we look at copay under the Essential Plan 2 and 3, we'll see that there is zero copayment for all the services I've mentioned under the Essential Plan 1. But for your prescriptions, under the Essential Plan 2 and 3, generic drugs will be $1, preferred brand is $3, non-preferred will be $3 as well. Essential Plan 2 and 3. For Essential Plan 1, generic is $3, preferred brand is $15, and non-preferred is $30. For Essential Plan 4, there is zero co-payment for both services and prescriptions. Now the premiums. Before June 1 of 2021, there are certain premiums that you pay under the Essential Plan program. $20 for medical coverage only under the Essential Plan 1. If you choose to add dental and vision to your benefits, then you pay the additional cost offered by the plan you are selecting. Essential Plan 2 was offered at $0 monthly premium for medical coverage only. If you are dental and vision, you go by the costs offered by the plan you are selecting. Essential Plan 3 and 4, since it is similar to Medicaid, has always been offering medical, dental, and vision benefits for $0 monthly premium. But effective June 1 of 2021, there is a new rule under the marketplace, which is now providing medical, dental, and vision benefits at $0 monthly premium to all the 4 levels of the Essential Plan. And like I said at the beginning, there is no deductible under the Essential Plan program. And for clearer understanding, premium is the amount you pay monthly to the health plan, and deductible is the amount you pay out of your pocket for services and prescriptions before they become subsidized. And after that, I want us to look at enrollment. By enrollment, we mean plan selection. And the general rule of the marketplace for enrollment goes by what is called the 15th of the month rule. By the 15th of the month rule, it means when you select a plan between the 1st and the 15th of a month, the plan selection will start the next month. If you are picking a plan after the 15th of a current month, plan selection will be starting the subsequent month. So for Essential Plan 1 and 2, the 15th of the month rule stands. Plan selected under Essential Plan 1 and 2 goes by the 15th of the month rule. Essential Plan 3 and 4 would start from the beginning of the month of the application. So if you qualify for Essential Plan 3 and 4, because they have similar characteristics with Medicaid, the plan you are selecting starts from the beginning of the month of your application. Just as Medicaid will start from the beginning of the month of the application, it is just that with Medicaid, the plan does not start from the beginning of the month of application. Plan selected under Medicaid goes by the 15th of the month rule because Medicaid can stand on its own without a plan. So you have regular Medicaid from the beginning of the month of application. Plan selected goes by the 15th of the month rule. But because Essential Plan is not a program that can stand on its own without a plan, plan selection for 3 and 4, which have similar characteristics with Medicaid, will start from the beginning of the month of the application. Now, these are circumstances or situations that might terminate your Essential Plan coverage. Change in income and family size. You are required to report all changes on your application within 30 days of the change. So if you have had a change consistently for 30 days, it is required that you report it on your application. So when you report change in income and you qualify for the Essential Plan, that eligibility might change based on reported changes. So you might have a change in eligibility from Essential Plan to Medicaid, or from Essential Plan to Advanced Premium Tax Credit with or without cost sharing reduction. You might also have a change from Essential Plan to full pay coverage, depending on the change you are reporting. Failure to submit required documents can also terminate your Essential Plan coverage. So when you are determined eligible for Essential Plan and the system is requesting you to provide proof of information provided on your application, it will give you a deadline to submit the required document. You want to ensure that the document is submitted within the required time to avoid cancellation of your coverage. There is option for extension of time to provide required document. Then when we have undeliverable address on your account, probably you change your address, you moved from one place to another and did not go on your application to update your new address. If that information filters into the New York State of Health system, probably through the postal services, this might cancel your coverage to ensure that your insurance information is well protected and avoid having your notices sent into wrong hands. Also, if you become eligible and enroll in a third-party health insurance coverage, like your employer's coverage, if this information also filters into the New York State of Health system, or you report that you now have employer's coverage, Essential Plan coverage would be terminated because it is unlawful for you to have Essential Plan and a third-party health insurance coverage at the same time. If you move out of state and report an out-of-state address, or the system found that you are no longer resident in New York State, your essential plan coverage could also be terminated for this reason. On your application, there is a tab that asks the question, do you need health insurance? If you say yes, you have coverage. If you say no, previous coverage would be terminated. So clicking no to that question is also a possibility of terminating your essential plan coverage. Like I said earlier too, there is a financial application and non-financial application in the marketplace. If you change your application from financial to non-financial, this would also take away your essential plan coverage because essential plan is one of the programs under the financial application. It's not available under a non-financial application. Now, like all other New York State of Health marketplace programs, you can also dispute and appeal your essential plan determination if you are not satisfied. A valid appeal must be submitted within 60 days of the disputed decision. And the New York State of Health offers what is called the ADR system of dispute resolution, that is alternative dispute resolution system, whereby an agent of the marketplace will review the information and look into your complaint on the application to see if there is possibility of making any amends to resolve the issue. Now, this still does not stop you from filing an actual appeal through the marketplace. You can go through the ADR, and while waiting for outcome of submitted tickets or requests to resolve the issue, you can still go ahead and submit a valid appeal. And if the outcome of the submitted request comes out to be favorable, and then you can go ahead and cancel the actual appeal. Otherwise, you go ahead with the actual appeal process. And if you are still not satisfied with the outcome of the appeal, you have the right to challenge the appeal decision at the Supreme Court. For any further information, questions, you can reach out to the Legal Assistance of Western New York. My contact number is 585-504-2660. The Navigator intake line, that is the general line for you to reach out to any of us assistants with the New York Legal Assistance of Western New York. Contact number is the 855-250-7748. And you can also visit our website, www.lawny.org, to make a request and ask for assistance. If you have any questions, I'll be glad to attempt to answer it to the best of my knowledge. And if there are questions that cannot be answered at this presentation, I can pen it down, and the response to that question would be published on the Legal Assistance of Western New York YouTube channel under this presentation. Thank you for listening.
Thank you, Bishi. If anyone has any questions, they can put the question in the chat box, or you can unmute yourself and ask Bishi the question. You're welcome, Miraya. Great presentation. It doesn't seem like anyone has any questions.
Yes, sorry, I will be faster speaking than writing. There is a deadline to enroll to the essential plans, and the deadline is 31 of December.
No. For the essential plan, You can apply at any time during the year.
Okay. Okay, thank you.
Yeah, so open enrollment only applies to advanced premium tax credits and full pay qualified health plan. We'll be talking about that at our subsequent presentations. But for the essential plan, you can apply from 1st of January to 31st of December at any time during the year.
Okay, thank you very much.
You're welcome.
Are there any other questions? Okay, well, thank you for attending, and we'll hope to see you at the next series. Have a good day, everyone.
Bye, thanks.